Hi, my name is Manish Gupta, and in this video, I'm going to talk about WSNet towards an effective method for wound image segmentation. This work is in collaboration with Subba Reddy Oota, Vijay Rowtula, Shahid Mohammed, and Minghsun Liu. This work is a collaboration between WoundTech, IIIT Hyderabad, and Microsoft. So motivation is that automated segmentation of wound regions is a very critical component for processing patient images. It can aid clinicians in measuring and managing chronic wounds and monitoring the wound healing trajectory. Existing methods, however, are limited to segmenting a smaller subset of ulcers, such as foot ulcers, with no specific processing for wound images at all. We in this work we build segmentation models for 8 different types of wound images. The impact of using segmentation for improving the accuracy of downstream tasks is really nice. So we in fact show results on wound area and volume prediction. This task is challenging. The wound segmentation task is challenging. In fact, wound image analysis is itself challenging due to lack of availability of extensive data. AZH dataset has just one wound type, while Medetec has again another dataset with just one wound type, foot ulcer, and the datasets are pretty small, 1K or 600 images in size. Annotation is also challenging due to shortage of well-trained wound care clinicians. Well, this task is complex because of the heterogeneous appearance of wound area across images of different similar wound types. Right? Here are some images, and as I mentioned, there are 8 different types of images in our data set. These are the original images that you see at the top, and at the bottom are the segmentations manually annotated by various experts. Right? In this work, we basically make the following contributions. We actually contribute WoundSeg, which is the largest available data set of segmented wound images, 8 different wound types, 2,686 images. We also contribute a novel segmentation framework, WSNet, which leverages wound domain adaptive pre-training on a large unlabeled wound image collection. It also proposes a global local architecture that utilizes full image and its patches to learn fine-grained details of heterogeneous wounds. On WoundSeg, we actually get a very good dice score of 0.847. And on existing datasets, we also show that we establish a new state of the art. Here is the model architecture. It's a global local architecture. So there is a global way of processing, and then there is also another path, which is a local way of processing things. We believe that it is important to see the image both from a global perspective as well as a local perspective. And then, so both of these, pathways essentially make use of various segmentation architectures, which are popularly known. Uh, and then we basically concatenate the global and the local path so as to finally obtain the overall segmented image. So the methodology is as follows. We propose 17 different backbones, wound segmentation models, and 4 popular segmentation architectures. We then also perform wound domain adaptive pre-training, then fine-tune on labeled image segmentation data. We actually do awesome data augmentation, horizontal flip, random rotation, and so on. And finally, we use a global local architecture. Here are results from our paper. So we observe that each of the steps that I talked about essentially add more and more accuracy in terms of different backbones and architectures that we experiment with across the 2 matrix IOU and DICE score. We obtain the best results with our approach WSNet, which combines global local processing with WDAP and data augmentation and end-to-end fine-tuning. Here are some predictions. So as you observe, this is the ground truth. So basically, our best models essentially obtain very similar results compared to the ground truth. Right. Here is the DICE scores. And again, we obtain very comparable DICE scores on WoundSeg. Thank you.